By now, you've probably heard of COVID-19 or coronavirus disease discovered in 2019. COVID-19 is caused by SARS-CoV-2, or severely acute respiratory syndrome coronavirus 2, because it's genetically similar to the SARS coronavirus. Now, coronaviruses that circulate among humans are typically benign, and they cause about. In COVID-19, what happened is that there was a coronavirus circulating among bats, which are a natural animal reservoir, and it mutated just enough to start infecting an intermediate host, the pangolin, an animal that looks like a cross between an anteater and an armadillo. In late 2019, as of March 9, 2020, or roughly 3 months into the outbreak, there have been 109,578 confirmed cases of COVID-19 and 3,809 deaths, resulting in a fatality rate of based on a large study in China. Digging deeper reveals that the fatality rate in China was actually 16% for cases between January 1 and January 10. But then, it fell steadily over time until it was only 0.8% for patients with symptom onset after February 1. There are two main reasons for this. First, the hospitals and clinics were initially overwhelmed and couldn't manage the disease. So both patients and healthcare providers were getting severely ill and dying. But within a few weeks, with better equipment, testing, and processes in place, the healthcare system. It's also worth pointing out that for COVID-19, the mortality rates differ by group. So for example, if you split things out by age, you can see from this table that fatality rate is relatively low if you're below 60 with no deaths seen in children 9 and younger. But then it starts to really climb up for the elderly. So they're really the ones at highest risk. Similarly, the fatality rate is higher for folks with hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer relative to folks without any of these conditions. And of course, now although the COVID-19 pandemic is still ongoing, the good news is that in China, and also in South Korea, the number of new cases per day has dropped off, largely due to the aggressive public health measures based on the current data, over 80% of the patients with COVID-19 have a mild infection, and some people don't develop any symptoms at all. For others, they can develop symptoms that can range from pretty mild. Severe lung damage can cause acute respiratory distress syndrome or ARDS, which occurs when the lung inflammation is so severe that fluid builds up around and within the lungs. The severe infection can cause septic shock, which happens when the blood pressure falls dramatically and the body's organs are starved for oxygen. ARDS and shock are the main cause of death for people with the infection. In addition to causing disease, coronaviruses can spread quickly. Usually the virus spreads when people cough or sneeze and tiny droplets containing the virus are released. These droplets can land on another person's mouth, nose, or eyes, and that allows the virus to enter a new person. When a person with COVID-19 travels to a non-affected area, this is called an imported case. If they start spreading the disease to household contacts and those around them, it's called local transmission since it's usually isolated to a small area and can be easily traced back to the original person. To prevent or contain community transmission, some schools and businesses have shut down and some conferences, sporting events, and other. Once a person is infected, symptoms develop about 5 days later. This is called the incubation period. Now there's debate about how much asymptomatic or pre-symptomatic people, which is to say folks that are in the viruses are given a reproductive number or are not based on how quickly they spread, and person-to-person transmission has been confirmed both in and outside of China. And R naught of 1 means that an infected person passes it on to one new person, and R naught of 2 means that one person spreads it to 2 new people and so forth. If the R naught is below 1, the infection peters out. If it's at 1, it's to confirm the diagnosis. A reverse transcription polymerase chain reaction, or RT-PCR test can be done, which can detect very small amounts of viral RNA. It's worth mentioning, however, That early in the disease, the RT-PCR can often miss the infection altogether, meaning that it's not very sensitive. So if severe pulmonary disease is suspected, a chest CT should also be done to help detect the presence of viral pneumonia. Treatment is focused on supportive care such as providing fluids, oxygen, and ventilatory support for really ill people. There's also early data showing that remdesivir, an antiviral drug previously used against Ebola, can be helpful, and it's being tested in large-scale clinical trials in the US and China. Unfortunately, there's no vaccine currently available to protect against, so the main goal is to avoid person-to-person transmission. In areas with community transmission, anyone with mild symptoms, regardless of whether they have been diagnosed as having COVID-19 or not, should wear a mask, and they should self-quarantine within their home. For people with symptoms that live with others, or even with pets, they should self-quarantine in a separate room and use a separate bathroom, if possible, and they should avoid sharing household items like bedding or eating utensils. In fact, there has been a confirmed case of human-to-dog transmission, where COVID-19 went from a person to their pet dog. However, the dog did. Finally, anyone with symptoms, including children and younger adults, should not attend school, work, or any. Now, for individuals that don't have symptoms but are at higher risk, like those over age 60 and people with a chronic disease, the recommendation is that they also self-quarantine to avoid the chance of getting sick. Self-quarantining requires keeping a few weeks' supply of coronaviruses. Don't usually spread over long distances in the air, but they can get flowing from one person to another on tiny droplets of saliva when someone's coughing or sneezing. In addition, with that in mind, if you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because they are meant to catch droplets from a cough or sneeze going out rather than preventing you from breathing in the virus. Similarly, wearing an N95 mask is not recommended because they're only meant to be worn by healthcare workers. In addition, cleaning and sterilizing frequently touched surfaces like toilet seats, door handles, phones, and keyboards is also a good idea. For healthcare workers who are around people with COVID-19, the recommendation is to apply droplet and contact precautions. That includes wearing personal protective equipment like a clean, dry surgical mask, gloves, long-sleeved gowns, and eye protections like goggles or a face shield. When performing a procedure that generates aerosol like tracheal intubation, bronchoscopy, CPR, or non-alright, as a quick recap, the SARS-CoV-2 virus causes COVID-19. The virus travels in respiratory droplets and enters the body via the mouth, nose, or eyes. It can cause symptoms like fever, cough, and shortness of breath, and in some people it can progress to more dangerous complications like pneumonia, ARDS, and shock. The highest risk is among the elderly and those with other serious health conditions. Treatments are focused on supportive care, but medications like remdesivir are in clinical trials, and there is a vaccine in clinical trials as well that will likely be ready by 2020.